Hi viewers, welcome back. Today we are going to discuss about placenta previa. When we come to antepartum hemorrhage, that is bleeding during the antenatal period, we have two major conditions of placenta previa and abruptio placenta. Placenta previa is nothing but the implantation of placenta in the lower uterine segment, either partially or completely. So, the incidence is going to be around 0.5 to 1%. So, when we come to the etiological factors, the major area goes to multiparity women. What happens in multiparity? So, when a woman is having multiple pregnancy, so the placenta is getting implanted in many areas. So, what happens? Naturally, the area becomes scarred and there is no area for the placenta to get implanted. So, it goes to the lower uterine segment and then gets implanted. When we come to age, so when women usually who are above 35 years, they are having more chances of having placenta previa, as because the uterus is becoming little older and the perfusion is decreased. And in conditions of lower segment caesarean section, that is a previous history of caesarean section, there is a scar formation and there is no adequate space for the placenta to get implanted. So, what happens? It goes and gets implanted in the lower uterine segment. Then we have size. So, when we come to the size of the placenta, so the size is big in cases of twin pregnancy, triplets and quadruples. In all those conditions you have big placenta. So, when the placenta is going to be big, so it needs adequate space for implantation. So, it goes in the lower uterine segment, which is more comfortable to spread and it gets implanted. And then we have smoking. So, in conditions of smoking, what happens? There is inadequate perfusion to the uterus. So, when the uterus is having inadequate perfusion, there is the placenta is searching for a particular area where there is more blood flow. So, at that time it goes to the lower uterine segments and get implanted. So, that is with etiological factors. And then coming to the types of placenta, we have 4 types of placenta: the type 1, the type 2, type 3 and type 4. So, when we consider the type 1 and type 2 type of placenta, they are little less complicated conditions where you can try for normal pregnancies. The complications are going to be very less. But when we come to the third and fourth variety, the complications are more, where the maternal and the fetal goes in for risk. So, what happens in first, that is when there is a placenta previa type 1, so there is only a mild area of the internal os is going to be covered with the placenta. That is, during dilatation of the cervix, what happens? This is completely removed and the cervix, the os gets opened easily. So, there is no complication. Again, in type 2, the similar factor happens where it is nearly to the os. But what happens? During dilatation, again the os is completely opened and there is no problem during normal labor. But in cases of type 3 and type 4, even after the dilatation of the cervix, there is the path of the os is going to be hidden. At that time the delivery is going to become complicated and bleeding is going to happen. So, these two conditions of type 3 and type 4, we consider it is going to be a high risk pregnancy. Then when we come to the symptoms, so usually what the mother complains of during the antenatal period. So, most of the time a woman rushes into a PHC or a hospital saying that she is having bleeding, that is like without any reason. That is like maybe during the sleep she gets a bleeding. So, early morning when she is getting out of the bed, she may complain of bleeding. So, first is sudden painless bleeding, where the woman is having painless bleeding and it happens recurrently. Okay, so that will be the first symptom a woman is going to say. When we come to the signs of placenta previa, we are going to observe the size of the uterus. So, what happens with the size of the uterus? There is no change because there is no uterine contraction initiated with placenta previa. So, at that time there will not be any change with the size of the uterus. So, you can be confident it is not abruptio placenta. and then we are going to see the mother is going to have malpresentations. Malpresentations can be either shoulder presentation, a breech presentation, or whatever it is, but there is going to be malpresentation constantly, as because the lower uterine is already occupied with the placenta, there is no space for the fetal head to get fixed up in the pelvis. So what happens? Always the baby's head is going to be floating. So you can see the head is floating always. The head doesn't goes and fixes in the lower uterine segment. Then we are going to see the fetal heart sound. So there is not there will not be any difference in the fetal heart sound. Sometimes you do an examination to rule out whether it is placenta previa. So what you are going to do is you are going to give a mild compression over the abdomen which compresses the placenta. So when there is a compression in the placenta, the fetal heart rate is going to decrease. So when you release the pressure, it is going to become normal, and that sign is called as Stallworthy's sign. So which is very important for your Viva question. So when we come to the management part, we are going to take management in 3 areas, that is your antenatal period, intranatal and the postnatal period. So all your disease conditions, you will be categorizing your management part into 3. So first is your antenatal care, what you are going to provide. So during the antenatal period, the nurse has to be very much vigilant about the blood loss. Okay, so first you have to give adequate antenatal care. So you are going to provide a constant regular antenatal checkup. So wherever it is in the PHC, if it is in the hospital or otherwise it is in the home care area, you are going to provide adequate antenatal care. You are going to rule out malpresentations and you are going to assess whether there is any bleeding. When we come to the intranatal area, so where the patient is going in for a delivery. So when the mother is on the table, what all you are going to assess? So you are going to assess whether there is warning signs. So that is like warning signs, you are going to identify whether there is sign of bleeding, the fetal heart rate decreasing, all these you are going to assess. You have to provide adequate bed rest for the mother. In case if there is heavy bleeding, you have to provide pads to assess the amount of bleeding. And in case if the mother is complaining of pain, you have to give morphine, which is the drug of choice when there is heavy pain. And you are supposed to do gentle abdominal palpation so that you don't cause any bleeding in further. And you always remember that there is no vaginal examination when the mother is having a diagnosis of placenta previa. And it is also like, unless you diagnose it is placenta previa or something else, you will never do a pervaginal examination. Okay, so then we move on to the complications during the placenta previa. So complications, again you can divide these complications in during the maternal period, intrapartum period, puerperal period and the fetal complications. So maternal complication, antepartum hemorrhage, malpresentations because of the lower implantation and preterm labor, as the lower uterine segment is already occupied, and if the woman is starting with bleeding, there may be contractions following bleeding and she may go in for a preterm labor. And during labor, the women may have premature rupture of membrane. So because of that, many of the time there may be a cord prolapse and there may be slow dilatation, and sometimes because of the low lying placenta, there may be most of the time an operative interference, that is like you can have a forceps delivery or a vacuum delivery because of the lower implanted placenta. And during the postnatal period, you can expect postpartum hemorrhage and retained placenta. So again, like you have crossed the intranatal period, So you are going to the postnatal period. Again the women can go in for complication which can include sepsis, subinvolution. Sepsis is infection as some bits of the placenta are remaining inside the uterus, and subinvolution, involution is the uterus getting reverted back to the pre-pregnant state. So in case if there is a low-lying placenta, it takes a longer time for the uterus to go back to the pre-pregnant state. So the uterus can go in for subinvolution, that is the involution which is less than the normal, and there can also be complications of embolism. And then when we come to the fetal complications, so in case if the bleeding is existing in the early antenatal period, the child can get aborted, or in case in the later uterine time, so it can cause low birth weight, and during delivery it can cause asphyxia, intrauterine death, congenital malformations and birth injuries. So with this we complete placenta previa. So next class let us have a discussion about abruptio placenta, and also let us discuss what is the difference between placenta previa and abruptio placenta, and when the woman is coming to an hospital with the complaint of bleeding, how to differentiate whether the woman is having abruptio placenta or placenta previa. Take care. Goodbye.